the best recommendation is no alcohol. That's the best way to go. Because it attacks the body in different fashions. First of all, it converts into acetaldehyde, which is a pure poison, changes the DNA of the cell.
There's an agency called the International Agency on Research for Cancer, IARC, and they have a four category system. Anything that's a category 1 is considered a human carcinogen. Now think about how hard it is to get to a category 1. There has to be evidence in humans that it actually causes cancer. Alcohol is a category 1, IARC category 1.
We found mouth, throat, voice box, esophagus, which is a food pipe, liver, colorectal, and breast. These are the ones which are definitely associated with alcohol intake.
We do several hundred transplants at Mount Sinai, and alcohol-related liver disease in the United States is actually the most common reason for liver transplantation in the United States. And women do process alcohol differently than men. At lower concentrations, we see significantly more damage to the brain tissue, higher risks of blackout. Alcohol-related liver disease presents in women at almost 5 to 10 years younger than men.
What we collect data on for the Oceanside Safe Coalition, we are prevention-based, so we try to increase education and also just try to increase community buy-in and community education as it pertains to underage drinking. And our youth themselves, even in our last youth development survey, they noted that societal norms and laws favorable to drug use and alcohol use are the biggest risk factor for them when it comes to substance abuse.
I think knowledge is power, and I think that an ounce of prevention really is worth a pound of cure. So any advancement we can make to increase patients' education, whether it's on the label of a beverage they're about to pick up, I think can only help the cause.
So it'll take some time for us to understand the true impact, but I do think that if we can reduce our population's use of alcohol, we will see a reduction in alcohol-related cancers.